Hi, potential neonatal nurse practitioner students. I'm Dr. Suzanne Stabler, and I am the neonatal NP program director here at Emory University School of Nursing. And so I just wanted to take a few minutes to tell you a little bit about the awesome and special population of neonatology and what it means to be a neonatal nurse practitioner. So a little bit about me. I've been at Emory since July of 2014 when Emory reopened their neonatal nurse practitioner program. This is the third NNP program that I have worked in as faculty and the first one for me to direct. And so I also maintain my clinical practice at Grady Hospital there in Atlanta, which is also considered part of the Emory system, which is a referral level 3 NICU. So a little bit about the neonatal population, because most people tend to think of neonates as newborn infants through the first month of life. And while that is the technical definition, for a neonatal nurse practitioner, our patients span anywhere from 22 to 23 weeks gestation when they're born, all the way through the age of 2. So I like to call our population age span fetus through age 2. And so we are the only nurse practitioners who are prepared to care for the very extremely premature infant and the fetal physiology that goes with that. And yet, we are also prepared to care for well newborns and infants through the age of 2 in primary care. So, a neonatal nurse practitioner can work in an NICU, whether it be a level 2 NICU, a level 3 NICU, or a level 4 NICU. We can work in a newborn nursery. We can work in the outpatient setting, seeing NICU graduates in pulmonary clinic or cardiology clinic for congenital heart defects, or developmental progress clinics where we're monitoring our NICU graduates and their developmental status. So we have a lot of different areas where a neonatal nurse practitioner can work. So some people are concerned about being a neonatal nurse practitioner because they think we're too highly specialized. Absolutely, we are highly specialized. So if you like babies and young children, this is the specialty for you, in my mind. There are some people who will say, well, maybe I should just be an FNP, and that way I'm more marketable and I can kind of do anything anywhere. I can see adults, I can see kids, I can see babies, I can do anything. That really is inaccurate, because the FNP role is really a primary care, community-based role. It is not an inpatient role, and it certainly is not acute care or critical care role. And so as an FNP, you cannot work in the NICU as a nurse practitioner. And so the other thing to remember about our program is the national standards require 2 years of nursing experience in a level 3 or 4 NICU within the last 5 years prior to admission to the program. And so many times our students they cannot enroll even as a part-time student unless it's a very part-time student right out of nursing school. I highly recommend that you go and work in an NICU for a year and then consider coming back as a part-time student while you continue to work. Our part-time plan of study is very doable for working nurses in the NICU. So much like all of the other programs at Emory, we have a part-time plan of study, which is 7 semesters. We have a full-time plan of study, which is 4 semesters. And starting in the fall of 2022, we will also have an option for you to earn your doctoral degree while also becoming a neonatal nurse practitioner. And so that would be not obtaining not obtaining a master's degree, but obtaining a doctoral degree. Um, Also, as a part of the program, you will be completing 750 clinical hours, assuming that in those 750 clinical hours, you can meet all of the neonatal NP competencies. So we have national competencies that our students have to be able to meet. And so if there is any difficulty there, that may require further clinical experiences and clinical hours in order for you to graduate. As always, with all of the program directors, I am absolutely happy to answer questions. You can reach out via email, and we would be happy to connect and talk further about the program. So if you have any questions, my email address is Suzanne, SUZANNE .Stabler, STAE as in Edward, B as in boy, LER @emory.edu. I look forward to hearing from you. Thanks so much.